marks are very clear.
I'm going to verify my physician orders, gather my equipment, and check expiration dates before coming in the room. I'm going to knock, enter the room, provide for privacy, explain the procedure, identify my patient using name and date of birth, and assess for any allergies. I'm going to identify myself, raise the bed up to working height, and put my side rail up on the side I won't be on, and then perform hand hygiene. I'm going to put a mask on my patient and turn their head away, and then put a mask on myself, and perform hand hygiene and put on gloves. I'm going to assess my site and palpate my port, and then discard my gloves, perform hand hygiene, and set up my sterile field. I'm going to get my clear prep and hold that over the port and clean for 30 seconds. I'm going to allow that to dry completely, and while that's drying, I'm going to get my line primed. I'm going to stabilize my port and insert at a 90-degree angle. Using my non-sterile hand, I'm going to aspirate for blood return and then push my flush. I'm going to apply skin protectant around the port site. And then apply my Tegaderm after that dries completely.
Oh, yeah.
And I'm going to initial date and time my dressing. And then I'm going to get alcohol wipe and clean the port. And then I would attach any IV infusions that are ordered, or if none are ordered, I'm going to put on a clean Kuros cap. I'm going to take the mask off my patient, discard my soiled gloves, perform hand hygiene, take off my mask. I'm going to clean up my area, and then I'm going to lower the bed, lower my side rail, give my patient their call light, and make sure the room is safe. I would report and record. And then to de-access a port, I'm going to verify physician orders, perform hand hygiene, gather all my equipment, and then I'm going to put on clean gloves. I'm going to put a mask on my patient and turn their head away. And then put a mask on myself. going to get an alcohol wipe. I'm going to stop any IV infusions that are going and will remove my Curos cap and clean the port. And then I'm going to flush it with saline or heparin according to facility policy and physician orders. And I would give, if it's heparin, I would give that at the prescribed strength and dose. I'm going to aspirate for blood return and then flush it at the prescribed rate. And then take a clean alcohol wipe and clean my port and reattach a clean Curos cap. And then I'm going to pull up the Tegaderm towards the port. And leave it on top of the port. I'm going to get a clear prep and clean vigorously around the port site. I'm going to allow that to dry, and then I'm going to stabilize my port and pull my needle out and put that in the sharps container. And then I'm going to take another core prep and clean my site again for about 30 seconds. I'm going to allow that to dry, and then I'm going to apply my dressing. I'm going to take the mask off my patient and off myself. I'm going to discard my soiled gloves, perform hand hygiene, clean up my area, give my patient their call light and lower their bed, make sure the room is safe, report and record.